our webinar, or huddle as we call them, for the Children's Health and Wellbeing Network. Thank you for joining us. There's still a few people dialing in, and I know some people might be dialing in and out if they've got busy days, but you're all most welcome, and thank you for joining us. So the focus of this webinar is on children's health and inequalities, and we'll go through the agenda in a moment, but I think first some housekeeping rules. Jen, you're probably best doing this bit. Do you want to just talk us through the housekeeping to make sure everybody's knows what we're doing?
Yeah, I can. As you can see, there's a lot of people here, which is fantastic, but also that it can be quite busy if there's a lot of activity going on. So we would just ask if you can keep yourselves on mute, unless you're obviously talking. And you can also keep your cameras off if you want to. There's no need for you to show yourselves if you want to relax a little bit and just listen and watch along. We are recording it for the benefit of people that aren't able to join, but don't feel self-conscious about that. You can ask any questions. In fact, we actively encourage it for you to use the chat box all the way through. So as the presenters are talking, you can pop questions and comments in the chat, and we'll pick those up in the Q&A sessions. And any other comments that you want to make about anything that you see today, or anything you want to contribute, please pop in there. And if you are on Twitter, please tweet along with the day. We've got the hashtag CYP Inequalities, and our account is EveryChildNENC if you want to mention us. Thank you very much.
Thank you, Jen. So we'll move on to the next slide, if that's okay. So yes, introducing ourselves. So you've met, so it's Mike McKean, I'm a paediatrician up here in Newcastle and a clinical lead for the Children's Health and Wellbeing Network. And that was Jen, our network manager, who's done all the work behind this. I hope you're going to find this a really enjoyable and fantastic day. We have got a packed agenda with various people giving talks, so we'll just go through as it comes, really. But I'm going to just set the scene to start with, if that's okay. So next slide, please. So this is just a reminder of our network. We have got a vision, and we also always put up what our young people and people we're connected to, professionals connected, told us they want us to do. And it's all about giving children the best opportunity in their life. That's what our network's about. But we wanted it not just to be a place to share and talk, but also and to connect people, but also to do as well. And sharing that good practice is what really today's about, because you guys are all doing lots of different stuff, and we want to celebrate some of that good practice. Next slide. Of course, briefly setting the scene, you know, this network came about because of a lot of concerns with children's health and well-being across our region. And just a very brief reminder of why the network was here and the levels of deprivation we see across the northeast and North Cumbria. And sad to say that as many of our local authorities or geographies or areas are in the top part of deprivation scores across England, and quite a few in the top 20, and sadly Middlesbrough being #1 at the moment. So there's a challenge for us to do something. Next slide, please. Our network came about from young people and primarily, and that we have some priorities. And I would say that the voice of children and young people is really the most important thing for us. And in fact, you could almost get rid of the other priorities and just put that first, because one of the things we've been learning is that if we engage with children and young people and their families, they know their problems, they know their difficulties, and if you can work with them, that will often help decide and drive where our work goes, and often goes in a better direction as well. But I'd highlight both mental health and poverty there as being right up there as being really key issues that our young people have identified over the last 3 or 4 years. Those are our network priorities. I would think that most of the things you're going to hear today will sing and to some of those priorities and really be important for them. Next slide, please. Our network's grown over time, despite the pandemic. we've actually continued to grow. And what we're really pleased about is that membership of over 1,000, now 1,300 plus. It's not just health, even though perhaps sometimes the health people amongst us, we can appear dominant and driving things. It isn't at all. We're seeing increasingly reach into the education sector and local authorities, which is really what we want to do. This isn't a health network, it's very much a well-being network, and we're kind of thinking very much about how do we give children the best health and well-being to reach their potential. Well, it can't just be from a hospital lens here. We've got to look at children's lives wherever they are. Of course, where they spend most of their time, both at home and at school, is so important for us. If you're not already a member of our network, you can find us there on the website. Sorry, it's such a long website address there, but you'll be able to find us and join us. So briefly, Jen's going to now take you through some of the work that's coming ahead of us and how we've selected some projects for sharing. Jen.
Thanks, Mike. Next slide, please, Anne. Doing my little Chris Whitty impression. Yes, so thank you so much to everybody that submitted a project abstract for our call out for this event. We were absolutely overwhelmed by the interest in it and the kind of breadth of work that we got to hear about through all your submissions. The problem with that was that it made it incredibly difficult to whittle them down to choose presentations that you're going to see today. And we didn't really want to leave anybody out because there were so many good ones, it was almost impossible to choose. So if you just click through just the bullets on this slide down, there's 4 of them. In theory. So yeah, so we've got 41 abstracts altogether. We used an initial review panel to shortlist those down to 15. And we have to thank David Garner from the Office for Health Improvement and Disparities and a lovely GP called Vishali Nanda who helped us shortlist those submissions down initially. And then we use an additional review panel because you need some fresh eyes on these things. We couldn't look at them anymore. And they whittled it down even further and we came out with the 6 highly commended projects, 5 of which you're going to hear about today. And 4 of them that they commended as being excellent pieces of work. And that's not to say that the others weren't also brilliant in their own ways, but we had to draw the line somewhere. So just big thanks to Professor Judith Rankin from Newcastle University, Sarah Borderley from the National Inequalities team at NHS England, our own Dr. Mike McKean, and the lovely young advisors from Children North East who also looked through them and gave us their opinions on them, which was some of the best comments that we had back. And I can name Claire and Zara in particular who helped us with that, and another one of the young advisors. So we're really grateful to their input. Next slide, Anne, please. So these are all the initial 15 that were shortlisted. If you just click on Anne. So out of the 41 that we had, these were the ones that stood out to us initially as being excellent examples of addressing child health inequalities for one reason or another. And they were all slightly different reasons and they were all brilliant in their own way, either because they demonstrated fantastic outcomes or we thought they had great potential for spread, any sort of way that you could have looked at it. And we were so impressed with the quality of all of the submissions. But these were the initial 15 that we've shortlisted. So congratulations to you if you're on that shortlist. You were absolutely fantastic. Next slide, please. These are the 4 that were commended by our review panel as being extra good, if you like. These are our silver medalists. So the Gateshead Trust asylum seeking work that we actually did a huddle about late last year was recognised again for the progress that they've made. Sunderland City Council submitted loads of examples of their work, which was excellent, and they've singled out the We're Here For You project from there. Reducing tobacco dependency in pregnancy across the whole ICS, and then the UK Health Security Agency working in children's homes around the time of the pandemic, at the height of the pandemic, which was really important piece of work the panel felt. Next slide, please, Anne. And these are the highly commended. So these are the ones that you're going to get to hear about today. We've got the Children's Foundation, who submitted 2 projects, both of which were picked. And the young people in particular love these projects. They really seem to speak to them. So we've got the Couch to 2K and the therapeutic horticulture work. Newcastle Hospitals working with school-aged children living in homeless accommodation, their 0 to 19 service. South Tyneside CCG and their annual health checks of young people with severe mental illness and learning disabilities and the development of their primary care health hub. And Investing in Children and their rapid response service preventing mental health admissions for young people in crisis. So it's quite a breadth of projects that you can see that we've chosen. And the last one is a network-wide project tackling inequalities for children, which is a huge kind of multi-pronged piece of work, which we would have struggled to fit into a short presentation in this event, which is why we're going to try and share that work separately a bit later on. Next slide, please, Anne. And then because everything was so amazing and we didn't want anyone to feel left out, we've said we're going to compile this showcase brochure, which is like a digital PDF that everybody's going to have access to. That's going to outline the detail of all the projects that we received so that you can read more about all the breadth of the work that's happening, not just those that are presenting today, everybody that's submitted. So that we just want to highlight the commitment that everybody has across the region, seemingly, to address this issue. So that will be, fingers crossed, coming out to you sometime next week. Once we've compiled all that information for you, and then that will be free for onward sharing or using however you like, and hopefully the projects included will get to see the benefit of that. And that's about me, I think. Mike, thank you.
Jen. So hopefully we're going to have a good period of time now listening and thinking about health inequalities. To set the scene, though, it's really important we know the context of where we are, and we're absolutely delighted that Julie Gillen has joined us. Not only she's the Chief Executive of North Tees and Hartlepool Foundation Trust, but she's also regionally been spearheading and leading some of the thinking and encouragement that is required to tackle health inequalities. And Julie's going to set the scene and also at the end share some reflections of what she's seen today and some of her thinking about the future work that's got to be done. So over to Julie, if that's okay. And we've got some slides for Julie. If you can put the first slide up, please. Next slide.
Okay, thank you very much, Mike. And indeed, it is a pleasure to join you all today. Fantastic news that we've got so many people who have joined this event from so many agencies and indeed professional environments. So whilst the event follows on from the success of the event held on reducing inequalities in healthcare summit in December, today is about understanding the context of children and young people and the inequalities affecting such, and how we continue to innovate and improve not only on our approach, but also our partnership and our interventions. And I think today what we're going to hear is an absolute set of presentations from people who are so passionate and so willing to improve the health and well-being of our children and young people. So if we can just go on to the next slide. What I'm going to do today is just provide that high-level context of children and young people's health inequalities across the North East and North Cumbria, and look at not only our challenges and successes, but focusing on those particular indicators that are associated with additional health inequalities in the short and long term. And we can all recall when Marmot published the 10 years on report, he specifically mentioned the North East. And, you know, we might say, yes, great, we're revered, we're in the publications, but for the wrong reasons. We had seen the most significant deterioration in health inequalities, and that included in children and young people. So it is a worrying trend that we need to understand to be able to tackle and see how we can improve our approach towards this. We need to consider the inequalities, and I'm going to look at that across the whole of the North East and North Cumbria population level statistics compared to the national average, but also within those based on not only the demographic factors, but the deprivation, the sex and ethnicity, and how this can impact on inequalities, and how we need to understand such as a root cause to be able to tackle this. And then let's reflect on the integrated care system and the partnership approaches to addressing inequalities and the value of a collaborative approach across that partnership. So moving on to the next slide. Some stark challenges and successes in the North East and North Cumbria, but just let's reflect on these to contextualise today and where we're going to put our efforts for the future. On the left-hand side there, you can see that the North East region has the highest child poverty rates in the country, with nearly 27% of the under 16s in families, growing up in families that have income which is less than 60% or 60% below the national average or the national median. This has a negative impact on children's health, their social, economic, and indeed emotional and cognitive development. We know that this can lead to differences in behaviours between the least and the most deprived, and can lead to changes in educational outcomes, and it puts strain on families and indeed can drive young people into substance misuse and indeed therefore a reliance on the health sector. So whilst there on the right hand side there is a significantly increasing trend and gap between England and the North East, rates in Cumbria have also increased though remain lower than England. So there is strong evidence here for ourselves to understand how poverty drives children and young people's inequalities, health inequalities. Moving on. Next, I just wanted to look at smoking at the time of delivery, the successes and the challenges that we face across the North East and North Cumbria. What's really interesting is I was part of a group which consisted of GPs, local authority directors of adult services, mental health professionals and clinicians to look at how we could look at the smoking at time of delivery across the North East and North Cumbria. And just thinking about how we did that and some successes in approach, we did, going back to what Mike said at the beginning, engaging and listening and learning with intent to young people and children and professionals, because they know how to drive change. And this is the approach that we took, that root cause and using ownership to drive change. So the North East on the left there has seen the highest rate for smoking at the time of delivery. Whilst there has been a significantly decreasing trend in the region, the gap has narrowed, of course, between England and the North East. We still have a huge challenge on our hands. All local authorities in the North East and Cumbria have decreased in the last 5 years, but there are inequalities between the most and least deprived. And I think what we need to understand is the work that we need to do to close that gap, to get down to our target of 6%, but to understand that the inequalities between the most and the least deprived deciles and start to tackle those, some of which are driven, as we know, by the previous slide, the poverty that we see amongst our families and children. Moving on then to school readiness, and again, some successes and challenges amongst school readiness. That level of development at the time of or the end of reception. Where do we see ourselves across the North East and North Cumbria? What are our successes and how do we actually tackle those inequalities that continue to persist? So what the graphs are telling us on the left-hand side there, we're now similar in the North East to the England average. Local authorities are all similar to or better, including Cumbria, than the England average, apart from look at Middlesbrough there and the absolute challenges we have in Middlesbrough across our whole region. We need to understand that large gap in school readiness between all children, but those that with free school meal status, the gap is larger. And we also know that there is a negative association of school readiness scores between those associated with socioeconomic status and also hospitalisation status. So we can start to think about how we utilise data and start to predict how we look at intervention and prevention. And this is something really, really passionate to me, that we understand our data and we don't just look at it once in a blue moon, but we actually understand and use it to drive the changes that we expect to see. So school readiness can vary between between males and females, but we also know that it is significantly varied between ethnicity. And I think that's something that we need to really dive into so we understand what is driving that and how we can remedy and prevent that. And moving on, if we now look at teenage pregnancy, again, the successes and challenges. On the left-hand side there, we can see that the North East region has the highest rate of teenage mothers, but we are seeing a significantly decreasing trend on the right-hand side there. Most local authorities, as you can see, in the North East and Cumbria have decreased in the last 5 years. But our influence comes to bear here, I think, when we look at the inequalities that persist. There are inequalities between the most and least deprived, quite significant in the most deprived at 1.3% above. And we're seeing sustained strategic prevention and intervention at scale opportunities here, I think. And we need to use that to influence. And when I say this is about our influence and how we bear upon our politicians, we've got the best chance ever now of influencing our government to look at how relationship and sex education plays a huge part in reducing teenage pregnancy, because we have a number of members of parliament across our North East region that can influence government policy and indeed educational policy. So we need to think about our local interventions, our professional interventions, and indeed our influence in the national arena here. Moving on to the next slide. Hospital admissions there as a result of self-harm between the years of 10 to 24 years of our children and young people. Quite heartfelt challenge here, as we're seeing, and we don't know the impact yet of COVID. And we know that COVID is having an impact on mental health. We're seeing that in the admissions into our mental health environment. And we've seen that certainly in the acute sector in terms of that self-harm, but we need to see this data now and how we can intervene. So
2 minutes, Julie.
Yeah, thank you. The North East has the second highest rate of self-harm, and we know that 7 local authorities are significantly worse there than the England average. But we need to understand how we can improve on this. So just going on to the last slide there, in terms of my summary. We're looking at, next slide, we're looking at the art of the possible here, where our mission for the children and young people's well-being can have the greatest influence. We need to see improvement at scale, the possibility of that and the persistent challenges we face, exacerbated by the rising poverty, but also as yet the unknown of COVID. We need to look at the solutions and interventions which involve the broad public health interventions, but also that primary prevention, the best start in life, and how we work with our mothers, maternity voices, and indeed our children to look at that best start in life across healthcare provision and understand the ownership we need to prevent that ill health arising. We need to work in partnership right across the region, nationally and locally, and we've seen some examples of that today. And then the emerging ICS have responsibilities to tackle those inequalities and outcomes, and that is where the Health Inequalities Advisory Group comes in, and indeed working together across all of our networks. So I think there's a huge opportunity here to succeed in the North East and North Cumbria, and as shown today, our commitment absolutely shines out to address these child health inequalities. Thank you.
Thank you very much, Julie. I think you've set the scene there. And what I'm really pleased about hearing is that some of the fine work, but also some of the improvements that are being made. I particularly noted the improvements in school readiness, although the inequalities that underpin it are still, so for many it's still a big problem, but it's nice to see some positive trends there against the backdrop of the North East and North Cumbria having very significant problems with health inequalities and inequalities as a whole. So I think there's some positive things there, but still a long way to go, I guess. As always, I think trying to improve and trying to make a positive change, you do need to have that mindset of where there's a challenge there to rise to and how we're going to do it. So we're now going to get our really positive heads on against that backdrop and say, well, what can be done? how can we work to turn the dial on those inequalities and continue to see some of those improving trends get better, and some of those that are going backwards, well, trying to tackle them. So I'm delighted now to introduce I think the first two presentations before we have a little mini break. I failed to sort of say one thing at the beginning. We will give the speakers a 2-minute sort of heads up if to help them keep roughly on time as well. I'm going to introduce Sean Soulsby, who's Chief Exec of the Children's Foundation. Children's Foundation is a long-standing charity who've done some fantastic work, both within hospitals, especially up here in Newcastle, but also out into the community. And Sean's going to share two of their projects, which we, as Jen had mentioned, we loved, and our children and young people particularly loved as well. Over to you, Sean.
Yeah, thank you, and good morning, everyone. I have to say it's a privilege to present not just one but two of our projects this morning, and the fact that they were highly commended by the young people speaks for itself. As a youth worker by trade first, and as CEO second, the voice of the young person is all that matters. So if we go to the first slide, please. So the Children's Foundation, we're a very small, independent child health charity. We're based here in the RVI, and that's because on the back of a government report in the 90s that stated children's health outcomes in the North East were the worst in the country, we launched a very successful appeal called the Yellow Brick Road and raised a significant amount of money to build the Sir James Spence Institute of Child Health, which we gifted to the Trust. So as a result, we occupy a very small space here in kind. And today we continue to improve the health and well-being of children and young people from birth to age 18 by making the serious stuff fun, because life's serious enough. And we focus on 3 areas going forward. We've just signed off on a new strategy, and that will be early years and supporting babies and new mothers, first-time mothers, to have a best start in life through our Baby Box project, mental health through our fuzzy subjects in primary schools, and therapeutic horticulture and physical health through our Couch to 2K and holiday provision. Next slide, please. So a Couch to 2K, well, what is it and where did we provide it? So as we were in lockdown in 2020, and that went on, the increasing voice that we were hearing from young people was a need to get out and about, be with other young people again, and escape their homes and their communities. And in short, Couch to 2K supports young people aged 11 to 18 to gain self-confidence, improve fitness, increase physical activity, and most importantly, have fun. And that was done via weekly walking, running, jogging sessions over 6 to 8 weeks. Key to it was that it was youth work led. And in 2020, the pilot was supported by a paediatrician, Dr. Vicky Thomas, and GNCH, and referrals came via her. These were young people who were inactive or otherwise not engaged in any sort of sport or physical activity. The location there on the picture might give it away. Was in Leazes Park in Newcastle, although currently it runs in Saltwell Park in Gateshead as well. The purpose of the work was it was funded through Sport England, administered through Rise North East, formerly Tyne-Wear Sport, delivered by us, as I say, supported by GNCH. And the typical referrals into the project in 2020 were young people with type 1 diabetes. There was a young person in there who'd had a kidney transplant. And young people with CF and other health conditions. And these were young people who we supported to literally go from the sofa to running a 2K run over 6 to 8 weeks. And it was a gap in provision for us. These were young people who, might not engage in PE, weren't interested in joining a sports club, were not going out every Sunday morning to junior park run. This was something in between and quite unique. Next slide, please. Most important of all, when I was putting these slides together, I wanted to ensure that the voices of the young people were coming through. So you can see some of the responses that young people had on the right-hand side there to some of the questions within the evaluation. And, the Couch to 2K for us was about supporting the wider health of young people, in many cases their families. And actually at the end of the project, all their families turned up to watch the young people do their time 2K in the park and cheering on. It was quite humbling to see. And it was helping the young people develop a more positive view of exercise, really, and increase their activity and fitness levels. And as I said before, these were young people who are not engaged in any other sport or physical activity, and most of them weren't even engaging in PE at school. And that was really important because there was no pressure to fit in or to be the best or have that awkward not being chosen for the team sort of scenario in subjects. This was informal. It was at the young people's pace, in their time. And for some of them, that was just about walking for the first couple of weeks or jogging. And I always recall one of the youth workers telling us that there was one young person who was being physically sick at the thought of actually having to do a time 2K during the sessions. But the youth workers supported the young people on a one-to-one, and it was more than just the running. It was about what was going on for them and their lives, how they were feeling. It was that informal support that helped those achieve the 2K at the end. Next slide, please. There's a quote there from Dr. Vicky Thomas, and that is her, as Fudge the giraffe in between the two youth workers on the final day of the run. And it was great success and lovely to have that support and backing from a paediatrician here in GNCH, because we didn't know whether the project would be a success or not. It was a pilot, as I say, but it was very, very successful. And thinking about some of the outcomes that we've had for the young people, all who took part in 2020, so 100% of those who took part achieved their 2K. All of them reported an increase in their physical activity and felt more confident. And all of them prior to Cowshire 2K were inactive, and in their words, usually at home, playing on game consoles or watching the television, and wouldn't go outside, especially during the lockdown or after the lockdown and subsequent summer holiday. And all of them, importantly, noted that being outside in the fresh air and nature was really, really important to them, and one of the most enjoyable things. The weather helped, as you can see in the picture. And young people talked about starting to move around a lot more at home, and trying to get steps in using their Fitbit watches. And there's often sibling rivalry between the young people. It became a competition each week when they were turning up. How many steps had they done in the week? And that was a real sort of spur for them. And that set themselves targets. And all the young people said that the sessions were fun and they'd like them to continue, despite the fact that after the 6 weeks, the sessions were due to end. A few of them did continue to run. And as a charity, despite the fact we had no money for it, we continued to meet them in the park each week to support them with their running for the duration of the summer holidays. Next slide, please. Thinking about some steps to success, the barriers to participation, I think, for me, is critical, and for the young people. What we wanted to do was ensure that there were no barriers or few barriers for those to participate. So what was really important for each young person was that they received a £55 sports voucher for a local sports shop, so they could get items, running, sports bras, T-shirts, trainers, whatever they needed in order to take part, helping them remove those barriers and also not feel ashamed if they were turning up without the correct gear. Each of them also received a very Billy Basic, I have to say, Fitbit watch, but that did help them with that sort of competition in between the weeks of who had done the most steps and the sibling rivalry that they had in their houses. So each one received a Fitbit watch, a water bottle. We did T-shirts and medals as well at the end for those young people, and that just made them feel, even more proud, I guess, and especially for the families on the end to receive the medals and see them getting that. And as I say, some weeks it may just be a walk, a jog, a talk. At no point throughout this project do we mention to the children and young people weight loss, obesity, or anything like that. That's not what it's about. It's not the first priority we're trying to tackle, although childhood obesity is huge. And this project is a project that supports young people to become more active. But this is about confidence. It's about self-esteem. It's about supporting young people to go from inactivity to some form of activity. And it's a start in that process. And it's a privilege to be able to deliver that. Next slide, please. Plans for the future. Well, we currently still have funding through Sport England in Rise North East, and it's running at the moment in Saltwell Park in Gateshead with young people in looked after care and we're busy recruiting through referrals through via GPs and hospitals here for the cohort at Leazes Park to start for the summer holidays. We're looking at expanding that reach, and I'm open to any conversation with anybody about how we can replicate and upscale Couch to 2K in other areas of the Northeast. And we're also exploring the possibility of social prescribing to take this forward. I've left my my email there on the bottom, and I know the slides will be shared anyway. I'm conscious I've got another project to present, and I'm assuming we'll just do questions at the end of both. Jenny?
Yeah,
we'll move on afterwards, Sean. So you've got 4 minutes for this bit.
All right, cool. Does anyone? So 4 minutes for questions, yeah?
Oh no, sorry, 4 minutes for your next bit of your presentation, and then we'll do
Oh.
questions afterwards.
All right, no pressure. Next slide, please. Okay, therapeutic horticulture. Therapeutic horticulture offers young people with social, emotional and learning difficulties and a range of other complex needs the chance to undertake a level 1 award in practical horticulture, and it primarily focuses on those who wouldn't flourish in traditional classroom-based environments or full-time classroom-based timetable, and especially those on the verges of exclusion. This is a project for them. It is, in a sense, setting up a garden from scratch in schools, and it currently operates in Southlands, in North Tyneside, and Hillcrest in Cramlington. And this project has recently just been evaluated by the University of Cumbria through the NIHR. So a lot of the stuff that I'm going to be sharing with you today are pinched from Tracy from the University of Cumbria, although it is all our work, so that's fine. I've threaded throughout of the slides on here the voice of the young person. So I think in almost all of the slides, there's a quote direct from young people, because, you know, that is the most important. And the purpose, well, creating a garden that acts as a safe space and a secure space for young people to develop and mix socially, make friends and learn a new practical skill. And it's been widely published and accepted the advantages of outdoor learning for better mental health, as well as positive effects on behaviour and physical wellness. And these areas are key for young people, particularly those on the autistic spectrum or with behaviour, which is perceived as challenging. Although I have to say, when the young people are in the garden, we do not certainly see any of that challenging behaviour at all. The garden is an open zone for learning, where young people can be as creative as they like. And it's led and assessed by partners from Northumberland College at Kirtley Hall campus. And it's predominantly for young people who are in year 10 or 11. And it's about developing teamwork skills and managing the outdoor environment. Next slide, please. Those are just some outcomes from the study as part of the evaluation and what was found, again, alongside a couple of quotes from the young people. But the study suggested a number of positive outcomes for young people, and those were a focus primarily on personal agency, positive life experiences, and health outcomes. And in respect of experience, engagement in horticulture activities and interactions with plants, insects, staff, place provided positive opportunities to develop core life skills, including teamwork, communication, problem solving, leadership and management. And obviously, in addition, young people found that safe space, again, similar to Couch to 2K, to discuss personal and collective issues and express themselves in developing personal resilience with the support of the worker. The outdoor experience, free from perceived confines of the classroom, is a huge plus, seemed a very important factor in giving the young people space and opportunity to develop their skills and attributes and to achieve their level 1 in horticulture. And, you know, we need to think about the explanations that these impacts have and thinking about restorative properties of the outdoors, interactions with plants, insects, the soft fascination this provides, various activities and tasks, and what that means to individuals, and the context of social interactions through this project. 83% of young people participated so far have achieved their level 1. And 84% of the first cohort left school and entered into further education or a horticultural related course. And of course, it's not for everybody, and we're not to say that every young person that goes through these projects will then go on to study a horticulture at a higher education. But linking up with Kirtley Hall College gives them that insight, because a lot of the some of the study days take part at the college themselves. But also for those young people who are unsure as to what they're going to do with their lives post GCSE, or have not even thought about further education as a possibility for them, it opens their eyes to that and allows them to sort of try before they buy in going to college, to be supported in doing that. And very, very successful project. Next slide, please. There's a case study there which pretty much summarizes everything I've just talked about, and how young people were seen during that evaluation, from being very, withdrawn, shy, not engaging at all over a few weeks, completely coming out of their shell, and to being different young people really through the project. So it's a nice case study to sum it up. Learning from both success and failure in the garden is vital, and it's a great life lesson, isn't it? In order to achieve their award in horticulture, they have to look after and care for the plants, because if they don't, they will die. And it's really important that young people see both the failures and successes in the project. I think the last slide covers some golden rules, I think, for this project to be replicated in other places. I want to draw attention to the need for tough love. And this is really critical, and it came out in the study of this project, because, I think a lot of people are frightened, I guess, sometimes at the idea of tough love for young people. But actually, for those who don't have boundaries, or very few boundaries in place, it's important to set them out at the start and agree that and stick by them. And it supports firmness when required to establish social behaviours. It promotes integration, reintegration, especially if those young people are going back into classroom-based learning. Offering choice in respective activities is critical, and the young people get to choose from a range of modules within the level 1 horticulture award that they decide to run. A lot of it will depend on the season, but there's so much choice, it's in their hands. And not being afraid to let young people fail. They can learn just as much from failure as they can from success. And obviously, I touched on that before when I was talking about caring for plants. A lot of them do die, and it's about talking through that. The importance of nature in young people's lives is critical, and they need to ensure that young people who are at risk of what's termed nature deficit are given opportunities to connect with the natural world. I think there's no bigger issue today than that of the environment and the green agenda. So projects like this help engage young people in that process. And again, the opportunity for that safe space for young people to have that one-to-one time to be supported to achieve something is critical. Last slide. Our plans for the future, I've simply said community. We're looking at replicating this model outside of school, in the community, and thinking about those young people who are NEET or are homeschooled, for example, as one young person that we're supporting at the moment through our allotment in Fordon. And we've become a registered centre ourselves with City and Guild, so we don't have to be tied to Kirtley Hall to enable us to be flexible and support young people within the community to achieve their horticulture. I will shut up now and take any questions of what's remaining of my time.
Thank you, Sean. What we will do is we'll go straight on to the next talk and then pull all the questions together from the chat box at the end of the second talk before we then have a little comfort break. Sean, just, it's fantastic. There's lots of comments there that I'm sure you want to learn, and lots of reaching out for connections because people want to see some of this spread. So have a good look at the chat box, Sean. So we'll move straight on, though, if that's okay, to introduce Laura Whitfield and Sarah Golightly, who have joined us to talk about their work particularly in developing a primary care health hub. And we're really interested in this. It's very topical at the moment, and I think everybody should take note of this. So we're really looking forward to hearing what you've been up to, Laura and Sarah. Over to you.
Thank you very much. I'm going to start off and then I'm going to hand over to Laura. So again, thank you for inviting us to this event today and the opportunity to talk about the work that we're doing in South Tyneside. So I'm going to provide a quick overview of the journey that we're on, and then Laura, my colleague, is going to provide more details in that what are we actually doing. So I want to give you just a little bit of background so that you understand where we are in South Tyneside. So we have a population of just over 150k. So we're not a big place. And actually we're 25 miles square. So again, we're not big in relation to where we are. But however, if everybody could see on the slides prior, we have high level of deprivation, and we have a high level of unemployment as well. We just have 21 surgeries within our borough, so we are quite small in relation to that as well. As I say, so we're small and unique. I think that's what we describe ourselves in relation to. So in 2019, we started this journey, and the slide gives just a little bit of background in relation to where we were. We were very low at the uptake in relation to health checks of 40%. We were one of the lowest within the areas for learning disabilities and for people who presented with mental health needs. Again, our numbers were extremely low. So we went out, and next slide, please, Laura. We went out and we said to people, so can you talk to us as children, young people? Why aren't you coming for your annual health checks? What can we do to make things different? And obviously then COVID hit us as well. So we spoke to people and had that feedback about, yeah, what is meaning that you're just not coming and having that interface really. And they were very blunt with us. So they said, well, you know, you're not accessible. It's not necessarily a priority in our day-to-day. You tell us that health promotion and thinking about our health is really important, but we don't necessarily know what's happening tomorrow, whether or not we can put food on the table for our young people, our children rather. So coming to see and linked with a health checks is not necessarily one of our priority. There was the impact of COVID. So what they talked about and what we had feedback was around the fact that when we phone up the GP surgery, it's really confusing of what you need to do. How would you get an appointment in the first place? And then if we do come in, then we're really worried that our children will get COVID. So there were some really practical things that they talked about in relation to it. And then also some of the things and the feedback that we got was about actually having time to come to appointments. So do we bring the rest of our children with us for appointments? How does it work in practice? So we took everything that they said and we worked with them in relation to how we could look differently. And our physical health hub is a lifespan. What we do is we work with different groups to help us support and develop the primary health hub. So we listened to what they said and we thought, right, okay, if it is difficult to access and we know that getting it right at the beginning is really important, what we'll do is we'll look at developing a primary health hub. And this is ever developing. So if I was doing this presentation in 2019, it is much different than where we are now. And if I was doing the presentation in 2023, it'll be much different as well. So our primary health hub is an extension of our GP surgeries, but the big difference is that they go actively out and support and look for supporting anybody who's on the GP register. It is a collaborative approach between the CCG, the council, and CNTW, our mental health trust, and the staff, while they're employed by CNTW, they actually work as an extension to the GP practices. So they're right on the GP notes. They have the full access as the same as GPs. Next slide, please. Lovely. So what is the actual service itself? So what we have, as I say, it's extension of the GP surgery. They work with children, young people, adults to literally look at what's important to them. And a sideline of that is then they support them to get their annual health checks done. So they're looking about what's important to the young person, but at the same time having that engagement in relation to making sure we have the annual health checks, that they know we're screening, and the links in relation to that. Any support or onwards appointments, because they're right on the GP records, it's one record, so they don't need to refer to GPs, they don't need to jump through any hoops, they just obviously are able to work in that multi-agency approach. It's very much around the person, so very much the people, young people don't need to come into the surgery, they'll go out to see them. Sometimes that's in their own home, sometimes, as Laura's going to talk to you about, that's in the schools as well. It's very much in relation to understanding where we've got highlight areas of further development. So some of the things that came through and some of our learning is around our young people and ARFID, and the service is now extending into that ARFID service as well. And we're continuously developing. So we've got children, young people and families who are feeding back, well, what about this? How do we change? What's the next steps that we can do in relation to it? Okay, over to you, Laura.
Thank you, Sarah. So as Sarah's explained, the Primary Care Health Hub really work to tap into that young person and family support network to understand actually what is the best way for them to be supported to receive that annual health check. So actually it's really promoting that think family approach. Now, for many children and young people, this support network will be their school. So in South Tyneside, we have high numbers of children and young people with a learning disability and autism who are educated in special schools. So we've commenced a pilot in 3 of our special schools for the Primary Care Health Hub to work directly into the schools to facilitate these annual health checks. And I just want to outline why this schools model is so beneficial. So the young person is supported in a place that is familiar to them. They don't have to go to their GP surgery and wait for a long time in a waiting room. As we know, this can be quite anxiety provoking for some of our children and young people. Not all of the children in the schools will be on the GP register with that diagnosis of a learning disability. So through the schools offer, this cohort of children and young people are still able to access this all important health monitoring, as actually the offer is not dependent on this diagnosis, which is on the GP register. The offer also supports with that early intervention work by really empowering the young person to take ownership over their own health action plan and actually really giving them the tools to carry this learning into their adult life, especially as they transition from children to adult services. And finally, the schools offer has also allowed the Primary Care Health Hub to provide this support around the Stomp Stamp ethos. Now, I'm sure many of you are aware that the Stomp Stamp stands for Stopping of Over-Medication of People with a Learning Disability and or Autism. So the team have been able to provide this advice and support around medication. So just in terms of the outcomes from the Primary Care Health Hub, so we are really proud that 87% of people with a learning disability on a GP register received an annual health check last year in South Tyneside. Now, previously, as Sarah mentioned, this was only 40% overall. But what I would really like to emphasise is actually the team really worked to take into consideration the variety of needs within South Tyneside. So each outcome is really reflective of the individual needs of the person. Now, we have lots of outcomes, but I'm just going to highlight a few because I'm conscious about time. So the team supported a young person to receive an annual health check in the home as the young person had really struggled to engage with their GP. So throughout the conversations, it became quite apparent that the young person was really struggling to access the community as they relied quite heavily on their sister's wheelchair. And actually this had prevented the family being able to go out together. So what the team did is they arranged for a wheelchair assessment to be completed, and now the young person has accessed their own wheelchair, and it's really provided them with some further independence. Another outcome is during an annual health check, this team spoke to a young person's parent about her concerns over the ADHD medication that the young person was taking, as she didn't believe it was working, but also she wasn't quite sure what to ask the consultant around the medication. So the team supported around the specific questions to ask to make sure that actually the right medication is being prescribed for the right reason and for the right amount of time. So really promoting those Stomp Stamp principles. And then just a final outcome I'd like to discuss is when the team worked with a young person with scoliosis. So due to the health needs that had actually been identified during the annual health check, the team supported the person to access a face-to-face clinic appointment with their consultant, which they hadn't been able to have for quite a long time due to COVID. But actually what this meant was that any unidentified health needs were able to be supported. So once again, really promoting these principles of early intervention and prevention. So just to focus on some of the feedback that we've received from families in South Tyneside about the support of the Health Hub. The support has been brilliant. The team went into school to see my son. They made him feel at ease as he struggles to answer questions. They got in touch with his consultant as we had been struggling to get an appointment before July. We straight away had an appointment for April. I'm over the moon. So as you can see, this family had really struggled getting timely access to secondary care, and I'm sure this has been a struggle that many families have experienced, especially throughout COVID. But as you can see, the support that the Health Hub gave to that family. And just a final bit of feedback. It was much easier having the appointment in the house. Usually we would have to take him out of school for his health check. My son doesn't like going to the GP because it's a long wait and he needs constant reassurance about why he is there. The anxiety of it often increases his blood pressure and it takes a few attempts before it stabilises. The Primary Care Health Hub was supportive, kind, and they made him giggle. So as you can see, really providing that real focus around what is important to the person, and actually how can we provide the person with the support to access their annual health check in a way that is best suited to them. So just in terms of the further development around the Primary Care Health Hub, as Sarah said, we are constantly changing. So feedback we've had from children, young people and families who have autism in South Tyneside is that they actually require some further support around their health needs and making sure that there is an accessible offer around health monitoring. So we are currently working to develop an annual health check for people with autism in South Tyneside. In addition, we have also recognised that children, young people and families may need that additional support to access their GP surgery. So this includes what reasonable adjustments they can ask for. This can be anything from longer appointment times or waiting in a quiet place rather than waiting in the waiting room before accessing the appointment. What we've also been told is that support is also required around understanding the health interventions identified on the person's health action plan and actually how to access those post-annual health check. So what we've done is employ third sector link workers who will work across mental health, learning disabilities and autism to provide this pre and post annual health check support. The role of the link workers will be to support the young person with the skills building and understanding about how to access health services and making sure that those health services are accessible for the young person. And what we really want to ensure is that young people are empowered to take these skills forward into their adult life to support the management of their own health needs. So that's it from myself and Sarah. So we're happy to take any questions.
Well, fantastic. Thank you, Laura and Sarah, and thank you to Sean as well. So we have got 10 minutes or so before we will have a little comfort break. I'm going to go first to the chat, and then if you haven't put it in the chat and you want to raise your hand, we'll also try and take some chat questions there. I'm going to start with one actually that's come from Helen. I don't know your surname, but I'm actually is probably applicable to both projects. I'm going to start with Sean and then also to the same question to Laura and Sarah, which is how this is about kind of how does your new innovative kind of approaches link into services that might be already there. So for Sean, that would be both, I guess, working with children who are not fit and perhaps overweight, but also those with mental health issues. Does your project sort of interdigitate with local services, or does it stand alone?
At the moment, it stands alone, really, is the honest answer. But of the what next, we're looking at how that can be integrated. And that's why we're reaching out to, well, certainly Newcastle through NGPS to think about referral system and linking with other health routes for in, whether that be school health, hospital, GPs. It's just getting in the right circles. Yeah.
And I think that's crucial, isn't it, to think about this, because that it's trying to ensure that the work continues as well with those children as they leave a project, that hopefully they've got a route for continuing growth and development. So that's really it. The same question then from Helen to Laura and Sarah is, and this is specifically, Helen's mentioned it, I'll read it out. How does this health check fit with the existing follow-up with children with learning disability to avoid duplication and unnecessary appointments? So many children, not all of them, but probably quite a lot with learning disability may be already under some sort of health follow-up. How does your hub and how does you communicate obviously clearly, seamlessly with the GP practice, but what about other professionals? How does that work?
So, I mean, we can always improve, do you know what I mean? And that's why I started to say that we're on a journey. But I think it's worth saying that the hub is part of the Best Start in Life Alliance. So our health visitors, our whole offer from our paediatricians is linked in with that as well. So really, it's a whole team approach. And obviously, we're describing one element of it today in respect to it. So we are embedding as much as we can. Obviously, there's always improvements. What we talk about in South Tyneside as well, we have the Thrive model, and we have that mapped out in relation to each element and try and ensure it's almost like a honeycomb and that everything's stuck together. So for the person, it doesn't matter who offers the service, we're all working together in relation to it and the young person. So yeah, we are part of that integrated approach, really.
Fantastic. We've got a nice question there from Claire Devaney Glynn. I've seen you online somewhere. Perhaps rather than me paraphrase it, Claire, if you're happy to unmute and pose your question, that would be great.
Yes, so I'm speaking from experience as well, because I am the adopted mother of 3 children with fetal alcohol spectrum disorder, and education has been really, really difficult for us. And getting my children to any kind of medical appointment, especially my boys, is impossible. It is actually impossible. It's like having to physically move to 6-foot mountains. They're so scared. So my boys haven't seen a dentist in 5 years. And so the sensory problems they've got with the pain that they've got in the teeth, it's just, and these are things that there just seems to be absolutely no help with. And I am very capable, and even I can't seem to navigate a way, you know, other than calling in a favour from a GP who will live on the same street as on the way home, saying, you know, you just call in and have a look at me here because I'm really, really worried. And a GP bringing a pre-made up prescription that they think may help, like, you know, that is them. That's just, you know, it's real trauma informed practice, but it's not practical and it's not sustainable. So my children, and even though they are registered with special schools, they're unable to attend because the schools aren't fit for purpose. So medical appointments are a real issue. So I think this is amazing. You know, this is really filling me with hope, because it's fantastic that we're linking directly in with schools, because my children should be seen by a raft of people. And, you know, they refuse to attend. They don't refuse to attend. They've got a brain injury and they're unable to. And I'm physically unable to move them, but they still need that medical intervention. So I think it's something I would be really keen to link up with. Sarah, I know we've spoke about different things before. I'd be really keen to link up with for like just the next step of that, what the next step would look like for those children who we really can't, and families who might find it difficult for you to be in their home as well. You know, I would have my doors open for anyone to come in and help, but there are a lot of families who wouldn't be able to do that. So
thank you.
I would love to meet up, Claire. It's really good, you know what I mean? I mean, we're ever developing, to be fair. And I mean, you know, the steps that we've took and this stage is directly because people have told us, well, you know, you need to look at this. Now, the fact is, when you're getting that feedback, then you need to keep that feedback loop open each time. So it would be brilliant, Claire, to link in, yeah. And I've got you, so yeah, we'll do that.
Claire, may I just say, Claire, thank you for sharing that. And I think it's really interesting. I think there's 2 things. You think about transition. I know there's a lot of work thinking about transition to support young people from child to adult healthcare. But I think post-pandemic, we need to be thinking about transition as in getting young people back in from the community to hospitals for those appointments. And good healthcare doesn't start and stop in hospital. So I think if we can develop interventions in the community to support young people back into their healthcare appointments, I think it's key. So I think we need to be thinking about transition in 2 very different ways now.
Thank you. Really good points and good mentions there. I'm just going to briefly mention Susie Beatty and also Caroline Steele, if you've not seen it, Sean. So offers from areas of Durham saying they're interested in some of your work. How can we spread this? There may be some traction there. And also Leeds Children's Hospital. If we've managed to do something in the park next door to us, what about the parks next door to Leeds Children's Hospital? But maybe other places too. We totally love all you're doing there, both horticulture and Couch to 2K. There's lots of comments there. I've got one question for you, Sean, from me would be, what I'd be interested in thinking about if you if you're either not doing this or thinking about doing it, is trying to follow this and research and understanding the impact of this. You've got impacts during the project and immediately after them. I'm wondering what happens to these children long term, and I presume you've got an ability to keep in touch with them to see if some of the impact that you've seen is sustained. Is that something you're thinking about or wish to think about?
It's something that we wanted to think about and would like to look at as we scale up the model. But most of the young people who took part in 2020 remained in contact with the project after the Couch to 2K ended. Many of them through the holiday activity provision through the Fit and Fed, the DFE funding, as we continue to provide holiday trips and activities for young people throughout the pandemic.
Fantastic. We've a little comment just to mention from Greta DeFater, who's a big supporter of our network and also does amazing work herself in Northumberland University, just highlighting that there is some DFE funding coming soon for out of school activities in September, so it may be people wish to be aware of that. I think Jill Turner, would you like to unmute and perhaps pose your question yourself, Jill, if you're still online?
I am. I'm just here.
Fantastic.
Yeah, it was really a question to Sarah and Laura, but it's great work to work directly with families, with young people with those challenges. If you identify a young person in school who isn't on the GP register, either as LD or SMI, how do you then arrange for them to be on the register? Because I'm aware there's a bit sometimes controversy around diagnosis of LD and who does that. So have you come across that and how have you solved it?
I don't think we've solved it, Gillian, but the bottom line is if we've got a young person who is that we've seen, then we wouldn't exclude them because they didn't have learning disabilities. Or so what we do is we do exactly the same support, and because it's been highlighted. So the fact that they're engaging and they want the support around us would be the predominant factor, and the team would do that. So, and Laura, the post that Laura was describing that we've put in additional, they specifically say you don't need to have a diagnosis at all, just so that we can get through that. I mean, to be fair, what we're wanting to do is look at health inequalities. We managed to get the funding to start this off around learning disabilities and mental health because that was where there was a big focus nationally. But for us, it's health inequalities, irrespective whether you've got a diagnosis or not. We want to get in there and get the early intervention done, really. So yeah, we haven't solved it. We try and keep out of the debate on whether they're on the register. We just see them and say, yeah, there's an open door in relation to that.
And if anyone else has a solution, because once they leave the cocoon of what you can offer, or if they get older, we absolutely need to be sure that they are flagged in primary care. Otherwise, they don't have access to those services. So we need to kind of crack that somehow. Thanks.
Thank you. Very important points there. Some points from, brief questions from Sashwat Saran and Karen Armstrong. Firstly, child protection and child safeguarding, possibly, is that something from both projects here? Is that something that you brought into your work or been aware of or had any issues with? And if so, what's your learning from that? Safeguarding issues. Sean, if you want to, do you want to go first, and then maybe Sarah or Laura?
Yeah, thankfully, we've not had any safeguarding issues come up from the young people we've supported to date, but a lot of our referrals come through children's social care anyway, so often those young people are subject to a plan of some description. So there's the information is there for us to see and to share should we have concerns, but it's obviously at the forefront of all of our work.
Thank you. Sarah, Laura, have you got any with safeguarding issues, particularly something you brought into your work or were engaged with in any way?
I mean, I think we're the same as Sean. I mean, to be fair, because of the organisations that's involved, obviously they're part of the MDT if needs to be going forward, but we haven't had any specific cases to feed back in for here.
And a very brief one to you, Sarah, before we close the discussion. Opportunity for bringing midwives into this hub and that very early intervention, which is so important. We talked about, Julie touched on smoking, for example, and many other things. So is that something that you're either doing or planning to do, Sarah?
We haven't so far. However, I think it's a good point, and you've given me a good point to think back to, talk to our families about and say, what about this suggestion? So yeah, we will be feeding that back to our families and young people and see what they think, definitely.
Well, thank you. I think we'll close the discussion there. Thank you for those who've contributed questions, and we really appreciate that. And we really appreciate and would like to extend the network's thanks to Sean and his fine work. Please do share that with Vicky and the team, and particularly your fantastic youth workers, Sean, and also to Sarah and Laura. Stepping into a new direction and being very proactive has certainly already impacting quite a lot of children there. So power to you and keep it going. And a lot of interest in spreading some of this work as well. So I hope you can connect with our network. For those who are not already members of the network, please log in at some point and join us, because we send lots of information out, and hopefully it will give people encouragement to carry on their fine work. So we're going to have a 10-minute break. We'll be back here at what's this say, 20 what are we now? We're already 2040, so we're back at 10:50. And for those who are listening in the background and don't need to go and grab a cup of tea, we're going to be playing a message from Dr. Bola Owolabi, who's the NHS's Director for Health Inequalities. She couldn't be, we asked her to come, but she was otherwise engaged, but she sent us a little message. Hopefully that will help you connect to the national team who are really focused on this as well. So see you all in, well, it's 9 minutes now, and we'll start again with the next two projects.
I'm just going to attempt to get YouTube to work, so hopefully you'll be able to hear this once I start playing it. Just to make people aware that there is quite a bit of background chatter on this recording. Unfortunately, they didn't do it in a quiet room. So there are subtitles on it. So if you do have difficulty hearing it, hopefully you'll be able to at least follow along with what Bola's saying.
I'm delighted to be joining you today at the Northeast and North Cumbria Health Inequalities Summit with a particular focus on children and young people. When we consider that health inequalities are unfair and avoidable differences in outcome for people and communities within and between localities, I think it's especially poignant for children, given that the best start in life has a huge impact in terms of health outcomes and indeed life outcomes. And that is why I very much welcome and fully endorse the approach that Northeast and North Cumbria are taking in addressing poverty as a key determinant of health, especially as it affects children and young people, both in terms of their health and their wider outcomes. And that is also the reason why the National Healthcare Inequalities Improvement Program are working with NENC and other teams around the country and the National Children and Young People team to develop the Core 20+5 Children and Young People approach to tackling health inequalities. We know that Core 20+5 speaks to health care inequalities in terms of access to services, experience from services, and the outcomes that people gain from the services that we provide. But we also know that health inequalities are due to the wider determinants of health: education, housing, household income, employment. These are the wider drivers that the poverty focus that Northeast and North Cumbria are taking speaks to very powerfully. And I commend it to other parts of the country as we continue to do the work to narrow the health inequalities gap, to give children and young people the best start in life, to provide them with opportunities so that they don't fall off the cliff edge at the completion of their formal education, but that there are multiple pathways of opportunity into meaningful employment, which has such a profound impact in terms of people's health and life outcomes. So really looking forward to the learning that will come from this summit, and very much looking forward to the work that we will do together in the coming months on the Core 20+5 Children and Young People. Thank you so much for all the excellent work that you're all doing, and we all look forward to learning more from you. Thank you.
Thank you. It's just, 10 to 11, so we'll be getting going again. But I'd just like to pause there and just we'll extend our thanks to Bola. For those who haven't met her before, she's a true inspirational leader who's really got the bit between her teeth in saying, you know, very forthrightly, we have to tackle inequalities, and there are all sorts of inequalities. And she's trod a path which I think is admirable, and she's out up front saying we've got to tackle this, and she's a huge supporter of what we do. So I think it's a really important message for us there. The Core 20+5, if people don't know what she was referring to there, it's coming initially through into adult services, but there is work, and we've been part of the discussions for that, to bring something similar into children. And effectively, it's looking at your bottom, if you like, 20%, if you bought that's the bottom quintile in terms of any outcome, and the five bit is the 5 topmost outcomes that define those inequalities that they suffer. And i.e., it's going to become a priority for health, social care, and we hope it to influence education, that we start looking at some of the inequalities that really underpin why some people are disadvantaged. So we're very grateful for Bola for sparing some time to connect with us, and we will, as she says, we continue to connect to her very important work. So with that, I would like to move us on now. The second half, we've got two talks again, and then some questions, time for questions first, and then we've got some updates from the network about some of the work that's happening. So I hope you'll bear with us to go through all of that, and there's some fantastic bits of information as well as some inspiring projects to hear. So it's going to be over to Becky Humphreys, who's a specialist health visitor, who's going to tell us about how she's got involved in children in living in homeless, if you like, accommodation, and what she's been up to. Becky, would you take it away?
Good morning. Thank you so much for inviting me to speak this morning and hearing about the project. To say that I was shocked is an understatement, but here it goes. So I am a specialist health visitor for complex and vulnerable families in the 0 to 19 service, and I've been in this role for 2 years now. Prior to this role, I was actually one of 3 health visitors that did work into the homeless accommodation, but obviously we only worked with the under 5s, so I was fully aware that there was a gap in provision for school age children within the accommodation. Next slide, please. There's lots and lots of evidence around the impact of being homeless on children and young people. They are very, very much more likely to experience health problems than any other child, even children that are living in poverty who have a secure tenancy. The children often witness very stressful and traumatic events which are making them become homeless. And what I was really clear around was there was actually no local data on the needs of the school age children within Newcastle. And that is what I wanted to be able to look at. So during COVID, how we met with the children and young people had to change. We had the priority of our most vulnerable children and young people in Newcastle, and obviously the homeless accommodation, I would say, was our top priority. The majority of the children and young people in the accommodation were not open to children's social care, and even less had an early help plan, which meant that the only provision that they were receiving was the provision from schools if they were attending schools, and also the support staff in the accommodation, which are 4 housing officers. Next slide, please. So the homeless provision in Newcastle, it is a 45-unit purpose-built accommodation. It was built in 2013. It's very, very new accommodation and in stark contrast to what it used to be like. It is beautiful. That is the only way I can describe it. So any family that would need to be moving into that accommodation, I would say that their fears of what homeless accommodation is going to look like is relayed from the minute they walk through the door. They have up to 4-bedroom masonettes, which are very large. The flats, sorry, they have their own kitchen, their own bathroom, their own bedrooms. Very, very large. The only sharing needs that they do have would be for the washing machines. So as part of the strategy for Newcastle City Council to prevent homelessness, Newcastle has actually been able to maintain 0 households being accommodated in a B&B since 2006, and this is a real stark contrast to other core cities within the UK. And because of the accommodation that they provide in the strategy, they were actually the winner of the Gold World Habitat Award in 2020, and this was presented at the United Nations. But what was really evident from working with the accommodation for such a long period was that actually the voice of the children and young people within that accommodation, we didn't know what they were thinking, and we didn't know what their needs were. Next slide, please. So within the last year, we were able to offer well over 180 health assessments to school-age children. Well over 100 of those were taken up. A small proportion were declined. What I'd like to say around the health assessments that were declined, regardless of the parents' reason for them being declined, that still included a conversation about the family health, a conversation about what they felt the needs were with those children. So although it does look like they haven't had a health assessment, they've certainly had contact with a health professional who is shown interest to raise awareness around the health needs of those children. And as you can see, a very, very small amount were not brought. So that was really, really positive. Next slide, please. The health needs that we identified, so the data that we were able to produce was more than 50 of those families had dental needs. So when I say dental needs, these are children that were experiencing pain. They had very evident dental caries. They needed referrals straight away into dental services. Now that was either with the dental hospital or to a local dentist. Those families were supported to be able to do that. Referrals were made by the team of nurses that did go into the accommodation to do that. And 100% of those children and families were actually registered with a local dentist on top of the referrals as well. And again, the nurses supported those families along with the housing officers to complete those registrations. Second highest was vision. So these are children and young people that clearly had vision needs, previously either identified at their preschool, at the school checks, or had previously been identified through local vision screening. Again, with support from the nurses and the housing officers doing it collaboratively, these children and young people were then able to visit the local opticians and are in receipt of treatment for their vision needs, which again is really, really positive. Immunisations, there were some immunisation needs, and just due to the population of the families that were moving in, some needed referrals to TB screening, but the majority of those children and young people, it was supported through the GPs in the local area to be able to increase the immunisation uptake. In terms of emotional health and healthy weight, these were the two biggest health needs that were identified and took pieces of work for our school nurses. Healthy weight, there was a lot of children that were identified as being overweight, and we continue to monitor and put plans in place for those children and young people. Emotional health, again, we sourced from the school health team staff that would support those children and young people with the various emotional health needs that they had. There was no referrals into the SIPS mental health team. It was felt very much that the school nurses could support those children and young people, which was really positive. Next slide, please. And this is the lovely team of health visitors and school nurses that help set up the service into the homeless accommodation. And without their support, it just really wouldn't have been able to take off. I know that they are on the call today and willing to share any experiences that they've had in terms of meeting with the young people and hearing their voices. But certainly from the work that I've done in evaluation and hearing the voice of the young people, what we are very clearly hearing is that they want it. They want it to continue. They appreciate it from the 5-year-olds who refuse to go to school till they've seen the nurse, to the 17-year-old boys who want to meet the nurses outside of the family home to be able to ask questions about what it's like to be a 17-year-old boy. They want to know how they should be feeling when they're worried about what they've seen at home. They want to know who they can speak to. They want signposting to different services. And I feel very, very proud that these team of nurses have been able to answer those questions and support those young people living in those accommodations. We not only offer this service to the children and young people who are in the accommodation, who some are only in overnight and some are in a very short space of time. So sometimes we aren't able to actually make contact, but if they do move out, then we would make contact with them and offer them exactly the same service. Within Newcastle, we are going to be taking on temporary dispersal accommodation to prevent coming into the accommodation, and actually we have committed to those homes as well. So that's a further 8 homes within Newcastle area that we will be offering health assessments to those families. In terms of growth, I'm currently sourcing funding to expand the project. We have within Newcastle, we do have a number of alternative accommodations and supportive accommodations for children and families. And I would like to expand this into the next project would be into the specific domestic abuse arena in the refuge, and that is my hope. I am also hoping to be able to support funding to get a park for these children within the accommodation, because it has unfortunately been damaged and broken. So there's nothing there for the children and young people. But that's my dream. So open to questions from anyone, and if anyone wants to hear any stories from the nurses, I'm sure they'd be more than willing to share some.
Becky, thank you so much for that. We will move on to the next talk, but if anyone has any questions, do put them in the chat now. And it's fantastic just to hear some of your work there. And I guess this is a very targeted kind of approach when you know there's a group of people who are especially vulnerable. And I think targeting that is admirable, important, and it sounds like you've done some amazing work there. So anyone has any questions, do post them in the chat. We'll move on to our next speakers, who are going to tell us a little bit about their work in the mental health area and a rapid response service. This is Emma Rogan and also Neil Somervell, who hopefully will be able to take it away. They've got their slides going ready. So over to you, Emma and Neil.
Thanks very much, Mike. Good to be here today and to hear about the work that everybody else has been up to as well. So my name's Emma, I'm the Development Manager at Investing in Children, and I'm joined today by Neil Somervell, who's the team leader of the Rapid Response Service. We're hoping to have been joined by Bethan, who's one of the young people who was involved in the piece of work, but unfortunately she's not very well, so she's not able to join us today. So the Preventing Mental Health Admissions project, the work on this began back in 2020, and I've been responsible for overseeing the project, which is now concluded. And it came on the back of the fact that there was a recognition that there was some significant demands on the system within County Durham. So this is a project that's been based in County Durham, and it was noted that there was an increase in young people who were presenting in crisis, often following contact with the police, and these young people would end up potentially in a police cell or in a Section 136 suite or in A&E, none of which seemed particularly appropriate. And professionals recognised that there was people knew that those young people were on that pathway to an admission. So this project was set up to say, can we do something different? Can we offer something else to prevent that those avoidable admissions? So we brought together a partnership of professionals, young people and families to answer this question. We started off with what young people and families told us. So these are some of the things at the very beginning of this piece of work. Young people with experience of being admitted to hospital told us about what they would like to see different. So they want less drama, an alternative mediation and advocacy service. They want to get rid of the firefighters, so really bringing down that sense of a crisis and it being a much more measured and calm response. They talked about the lack of consistency of staff and services not working together, so the need for more joined up working. Young people feeling like they weren't being treated their age. We're not stupid because we're young, so taking them seriously and listening to them and them having things to say about the care that they need. The importance of it being a whole family approach, there being support and information for parents and siblings and trainings for professionals. And that the inpatient admissions don't always work, so we wanted that support to be available in the community. We know that sometimes hospitals where people need to be, but for some young people, and I think there were 22 young people who were admitted on 27 occasions between November 2019 and November 2020, and that perhaps not every single one of those admissions needed to happen and something different could be done. And a recognition, County Durham is it's geographically a very big area, so they didn't want it to be something that was just based in one area because not everybody could travel. So my slides will just move on. So one of the answers that we came up to as part of this piece of work was the Rapid Response Service, which Neil's going to tell you about now.
Thank you. Hello, everybody. My name is Neil Sunbell. I'm the team leader with the Rapid Response Service. I've been in position for about 10 months, and that's how long the service has been running. The aim of the service is to support young people via intensive support packages, tailor-made and tailor-created to their needs for young people who have been identified at risk of hospital admission or have been admitted with support whilst as inpatients, planning for discharge, or young people who are currently living at home, identified at risk. These packages, we don't have a timescale on them. It is however long is needed. We go through an engagement phase where we will just meet the young person, support the young person, create a professional trusting relationship, and then move on to help them feel safe, secure, and also support families, carers, and offer advice to them to help build resilience, to help support them. As I said, the packages are around their current multi-agency support network. All young people open to our service do have a social worker from Children's Services within Durham, and we support that social worker. And also, most of our young people are involved with CAMHS and have a CAMHS worker, and we'll support them as well. The service is based at Nettlesworth in County Durham, which is a small children's home which Durham County Council has, which is their emergency children's home, and that's our location under county-wide special services. So we are county-wide based. We work with young people who are from all over the county who are living at home as inpatients or children who are looked after.
So one of the real strengths of this piece of work has been the partnership element to it. So Neil's just going to talk you through the partnership that's involved in delivering the Rapid Response Service.
So the Rapid Response Service comes under Children's Services. We work very closely with our asset team, which is Adolescent Safeguard and Exploitation team, which a lot of our young people are open to, but also with CAMHS, with the Intensive Home Treatment team and the Crisis team, who have been involved throughout the process of setting up, from interviews to support without procedures. And what I do is I attend weekly huddles with CAMHS and also receive referrals from them, and have kind of constant support and interaction with CAMHS.
And there's also that really strong link in with the voluntary community sector. So Rollercoaster, who are a parent support group, are really closely involved in the delivery of the Rapid Response Service, and we at Investing in Children have been involved obviously in the project that set this service up, but we're also involved in supporting the continuous involvement of children and young people and evaluating that as part of the Investing in Children Membership Award. So when we were developing the service, it was clear from the beginning that the commitment to co-production, and we'll talk a little bit more about that later on in the presentation, needed to be there in the service that was developed. So there was a commitment from the beginning of the Rapid Response Service being set up that they would go for their Investing in Children Membership Award, which gives recognition to services that involve children and young people in an ongoing dialogue with that service that results in changes to how that service is developed. The engagement so far has been from United Voice, and you'll see their little logo down at the bottom, which is the Children, Young People and Families Mental Health Advisory Board in County Durham. So that's where Bethan's been involved in, as she was able to join us today. They've been involved in the service development so far, so in recruiting staff. And also we had a challenge session back in September where Neil and other members of the Rapid Response team met with some of the young people from United Voice that I've been working with. And you got quite the questioning, didn't you? You got quite the grilling. They asked questions. They asked a whole range of questions about the age range of the service. At that point, it was just up to 18, but Neil will tell you a little bit about that in the next slide, about changes to that, about who the staff were, about where they've come from, about making sure that they were really keen that there was support there for the whole family, about how confidentiality would be addressed, how competency would address, what if people don't agree between young people and families, about still supporting people if they went into hospital. And really interestingly, the young people had questions about, you know, care for staff and staff burnout, and making sure that staff took annual leave and were looking after themselves as well. now that the service is up and running and the project that I've overseen has come to an end, Neil and his team are really picking up on that involvement with young people who are accessing the service, and that dialogue with them is ongoing, so we'll continue to feed into how the service develops. So it's really been a strong partnership. So Neil's just going to talk you through some of the practicalities of how the rapid response service works.
So we're a team of 4 staff, and we receive our referrals from what's called the Dynamic Support Register, or via CAMHS Crisis. That register is basically, it's a register where young people are referred in or identified at risk of hospital admission. From there, it's a multi-agency forum where we get together and we look to support. That's when our support will begin. We need to understand that some of our young people are having quite a challenging, difficult time and a difficult engage. So our staff have become very, very good at that engagement and delivering the interventions young people need, and parents and the support to help build resilience, to help build, that feeling of safety. They're all individually done the packages to each young person. Once we've met, we'll spend time with young people, with the families, with carers, and work out what they need at that moment, what will help them and what will help them, the support needed to avoid admission, to help them, or to avoid readmission if young people have been admitted and have come out in the community and are living there. As Emma said, the voluntary community sector, we link in with them for any siblings. Then we can offer kind of community-based activities around their area, so then they can engage and access them. So the support is for the whole family as well, and that's where we do it. And in regards to the kind of multi-agency support, we work with their social worker, with CAMHS, and I'll come on to adult workers, because some of our young people are transitioning to adult services. So we communicate with them, we share all information, we attend all meetings and support our young people with any meetings that they go to or any kind of support that they need. We have the ability to do that. So far, as I said, we have 4 staff. We work with a maximum of 5 young people, and that is protected. We will not go any higher than that. That allows us to provide the intensive level of support to be able to visit young people 3 to 4 times a week if needed, or to kind of drop everything if there's a crisis, and then to go and offer that support immediately. All the staff have gone through since started a comprehensive training package where we've spent days with CAMHS, with IHT, the intensive home treatment team, with CAMHS Crisis, with our educare team, with the emergency duty team, and then obviously all of the kind of required training we need. We work with young people in the community. We work with young people who are currently living at home. We work with young people who are looked after children or as inpatients. If a young person wants to go in, we would start immediately planning for discharge and meeting young people on the ward and supporting them with their time on the ward, planning for when they come out so we can support them in the community. We mentioned the change in our age ranges. We have 4 or 5 young people who are becoming close to 18 and are now 18 and are quite concerned and anxious about the transition from children's services to adult services, how it looks and what support they'll receive. So we're looking to recruit another worker, which will allow us to continue to work with people, our young people, once children's services have closed, and we'll start working with adult services. From there, we can help them engage with their adult worker to a point when we don't feel we're needed, when they're meaningful and fully engaging with their worker. We will stay with them until that time, as opposed to a young person turning 18 and a lot of services stopped. We'll stay with them and support them until they feel comfortable, until they tell us actually that they are engaging and they're working well with their adult worker.
And that's really been in response to what children and young people have, well, the young people have asked for about that increase in age range. So just want to finish off just by talking about the power of co-production, and in the abstracts that we submitted for this, we were asked to talk about about how this could be replicated in other areas. And I think that, you could set up your own rapid response service, funding dependent and with that small team and that protected caseload. But if in terms of what I think the key to the success of this has been, I think it really has been about that co-production and partnership. And I think if you were going to replicate any aspect of this work, it would be getting that group together and really looking at what the issue you want to address in your area is, and whether that is around preventing mental health admissions, and looking at what already exists. And what could answer that question best in your local area. The Rapid Response Service was built there's a really successful Edge of Care team in County Durham, so there was a model there that worked that we were able to share with the young people, and we sort of built on that. So that would be my kind of key message, is that's been the real thing that has made this kind of the project that I oversaw in terms of doing the research, and then the service that Neil and his team have set up, is that it really has been in collaboration. So we recently did a evaluation at the end of that working group to see what people were saying. So we've got a quote at the top from a young person that was involved in the recruitment of staff. They took my opinion into account, even though I'm only 17. And the young person and the parent that were involved in recruitment were really impressed by how seriously things were taken, and actually, if people didn't agree that the level, that standard had to be so high, that actually it was better to start again rather than recruit people who weren't right for the job. One of the parents involved reflected that co-production has been central to the development of this work. Experts by experience have been actively involved in each step of the project development. So we had a steering group that was accessible to young people and parents to come along, and they also had their own subgroup where we were able to come together and really get into subjects that they were really passionate about that fed into this work. Such as waiting lists, doing that challenge session with the Rapid Response Service, people talking about their experience of crisis and what would have made the difference. CAM's manager, who's been involved, fed back that working across the multi-agencies, including the voice of young people and families, is really powerful and provides a good platform for change. And finally, I think this just sums it up really nicely, is from the Strategic Director at Durham County Council. Because we listened to young people and their families and carers with lived experience, we got the model and the approach right. So like I said, that's really been the foundation of this work, and the kind of key thing that I think if you're going to try and replicate something similar, that would be the most important thing from our perspective. I'm going to stop sharing my screen and we'll go back, because I think we're going to do questions all together, but thanks very much.
Thank you.
Thank you both, Neil and Emma, for that excellent presentation and sharing some of your work. So we're open to any questions. If anyone has, either jot them down or put your hand up. I'll start with just perhaps introducing, I don't know whether Emma's online, Emma Bowen, asking a bit about speech and language therapy. Would you like to unmute if you are and pose your question?
Hi, yes, thanks. It really was just that we are, I'm here in South Tyneside. We're quite a clinic-based service, but we are really aware of how difficult some families find it to access our service, and really wanting to get some feedback on sort of families in difficult situations such as this, as to whether there has been any feedback in terms of what we could do to make it easier for families to attend our services. And
this would be probably targeted, is it the homeless project for children who are particularly challenged like that? How can you encourage them to access your services? So that would be,
how could we make it easier for them, to come along, because we do work heavily with referrers to sort of work with families to encourage attendance, but we do appreciate that it's not always possible. It's not always people's top priority. Is there anything we could do to be a bit more accessible?
It's a great question, and that probably applies to both projects actually. So we'll take that first to Becky, and then perhaps Emma and Neil. So you're working with groups of vulnerable young people, and how can your work also work to how do you engage them in the wider services, and how do you engage the other wider services in your project? So perhaps Becky first.
Yeah, so from the project that we've run, there was very few that actually needed a speech and language referral. However, because of the way that we worked collaboratively with the housing officers, we sought permission from the children and young people and the families to share the referrals that we wanted to make with the housing officers. Once that was granted, we then discussed that there would be appointments coming to the accommodation, and could they be supported, and that support could be supporting them actually physically to the appointment, or it could be that they would supply a bus pass, or they would arrange transport for them themselves. But I do know that outside of the accommodation, any Newcastle have historically had a hard to reach speech and language service. So from health visiting, if I had made a referral and I knew that this family would struggle to attend appointments, or felt that they had needs which would mean that I would have to make a referral to the hard to reach team, that would just be a phone call to them and the referral form filled out as normal. And we would do joint visits. Obviously, myself and other health visitors in the area had that relationship with the family. It was a trusting relationship. So getting somebody new on board after you've identified a need is sometimes difficult for the families, particularly in the areas that I've predominantly worked in. And that has always worked really well.
Great, lovely. It's good just to get some ideas. Thank you.
I like that phrase, trusting relationship. That's come up a couple of times about relationships here. So we'll pose that same question, you know, Emma and Neil, thinking about kind of how if you spot children who need other services, or you think they need other services, how do you engage with that, and how do you support the children, and how do you support the other services in accessing those young people? I don't know whether
Because and say, do you want to talk, Neil, about what you do at the Rapid Response Service, and then I can talk a little bit about investing in children.
In regards to any young people that do need another service, after consent, we would support them with that. They have an allocated worker who is available, and if there was support needed, we do take young people to CAMHS appointments, to any appointments needed to college, support them there. So kind of we are available to support with any kind of need the young person who we are working with has and would do that. We would take them, support them, help them with any kind of the consent part, the actually attending, the setting the appointments up. So that's something we already do.
Thank you.
I think not related to this project, Emma, but one of our other projects, which is our Type 1 Kids project, actually began with the question about low numbers of young people attending the diabetes clinic in Durham, and that started with getting a group of young people together without any adults present. So what we call that an agenda day. That's a model that a trademark model that we've developed, and asking them about what were the things that meant that they weren't really engaging with the clinics. And so, you know, so I think in the first instance they were saying that, and this was sort of 15 years ago or so, but that it wasn't a very nice environment. The waiting room didn't feel very inviting. And actually, you know, so there could be some quite simple changes that young people have to feed back about what would make them feel more comfortable attending.
Lovely, thank you.
Fantastic. So we will move on. If there's any other questions, you put your hand up. I'm just going to share a comment which might trigger a question if I can think of one, which would be, I think Mary Hall has just commented on transition work. I think that was at the time when Neil was talking about that continuing work beyond 18, and good to see that that's in place. Would you like to expand on that, Neil, about the importance of having your key workers who are aligned to those 4 or 5 young people that traditionally in the past, you know, reach 18, we refer on to somewhere else? How has it gone in practice in stepping into 19, 20-year-olds? And what, have you got any experience to say how valuable that has been, and how has it worked?
Yeah, we have a couple of young people, 2 young people now who have actually transitioned over to adult services. We've already been we have no timescales on working with young people. It's not a set kind of piece of work or time. So we've been working with them for 6 to 8 months. So that trust and positive relationship is really strong. Leading up to 18, we start with engaging with adult workers, we'll support visits, we'll support the young people to see them, to meet them. So they're not meeting an adult worker on their own. We'll be there with them, we'll help them with that. And then, as I said, 2 young people are now 18, and we are continuing to do joint visits with the adult worker because they are very comfortable with our staff and from the support they've had over the last 6 to 8 months. So it's really helpful that we are there. We're there to support them with it, because a lot have said they are quite anxious about it, because from children's services with social work, with rapid response, with CAMS, to adult services, there is less support because they are adults, and it's that anxiety which we're trying to help manage, to help support. And the 2 young people in question I was talking about, you can see they are now starting to contact us less and contact their adult workers more, which is our goal. That's what we want them to take charge and to take that step themselves. So it is working.
I think that's just, sorry, Emma, you go first.
I was just going to say, just as I think I'm in a really privileged position to have sort of overseen this piece of work and seen the service as it develops. And I think that one of the things that I'm most impressed by is the level of flexibility that's been brought to everything, so that, you know, that the time frame is that until the young people are meaningfully engaged with adult services, not what we'll give you until you're 18 years and 6 months old, but until you're meaningfully engaged. And there's just been that real responsiveness that, you know, as we were starting, we think, well, it does need to be up to 18, it's within children's services, but that flexibility to extend that has appeared very quickly. And again, when it began, we were thinking, well, it would be preventing admission, but actually very quickly it broadened to, you know, working with people who are in hospital to help prevent readmission and that successful transition out of hospital. So I think that flexibility that Neil and the team have brought, with the support of the whole partnership, and there's been that commitment, you know, from a strategic level to do this, has just been excellent to see.
Meaningful engagement, again, another key phase. I think there's many people who get involved in transitioning services from children to adult services. There's many other transitions, isn't there, as well, into schools and various things, but that side of that meaningful engagement, I think, is interesting, isn't it? I mean, we've long known that most children and young people, and certainly if you're parents of young people in their early 20s, there's some good neurobiological evidence now that people's brains are not settled into a kind of an adult type of brain until probably the age of 25, and yet we persistently transition at 18. And I'm really interested in this meaningful engagement and this flexibility you've got. So one question from me, a follow-up on this, is what do the adult services feel of Neil, you and your co-workers still being part of it? Are they welcomed your engagement and that continuation, or have people been treading on toes, or has it been fairly seamless?
No, we are very welcomed, because we already have that engagement with the young person, with families. We know the young person really well because we've supported them through crises, through admissions or through discharge, and we'll support parents as well to build up their resilience, because we find a lot of parents are kind of, their concern is keeping their child safe. And given kind of the levels of their complexities, so adult services have been very, very welcoming and also very supportive, because we can help them with that engagement.
Fantastic. Just to highlight a nice couple of little interactions there. Rachel, I'll mention the quote there: if we are hard to reach, then look for us at different places, referring to young people who are traditionally thought and disadvantaged by being categorized as being hard to reach. And very important counter to that is getting the language there as underserved. So they're not hard to reach, but perhaps the services, as probably Emma's highlighted there, how do the services become more flexible in order so that people can access them? And I think we've seen some excellent examples of that flexibility. Really important. If there's any last questions, I'm scanning. Jen, have we got any last questions before we move on? I can't see any myself, but I'm not able to see everybody. So I'll assume, if that's okay, Jen, we will move on.
So, yeah. Mm-hmm.
So thank you, huge thank you to Becky and to Emma and Neil. Some fantastic work you're doing, and yeah, keep it up. And just whilst we get ready for our next bit, let me just see where we are. Because says yes, we're moving on to Luke, who'll be getting his slides ready. I've just been reflecting on a couple of things that I've been thinking about. Is something that I'm working with paediatricians in the Royal College of Paediatrics and Child Health, and that is just trying to get some things about trying to think about tools, or if you like, a framework of which a good integrated flexible project or service has within it. And I think we're increasingly thinking that health inequalities has to be part of everything we're thinking about with children and young people at the moment, if we're going to turn around some of the data that we've heard at the beginning of the seminar. Our workforce is absolutely crucial, isn't it? And that workforce, and I want to mention key workers. We've seen that now through several different projects. They may be health staff, but sometimes it's been social workers or mental health staff or physical health staff, but it's often been youth workers and other key workers who seem to be attached to children and young people and to seem to be able to make a difference. So thinking about our workforce is quite important. And I would come back to data as well. It's important that people share their outcomes, and innovative projects like this not only important in sharing the outcomes, but thinking about those outcomes moving forwards. How do we understand what interventions make a longer term difference is going to be really important for us. So 3 things there for that I wanted to just share and that I'm thinking heavily about. So we're going to move on now into the last bit of the huddle today. There's going to be 2 sections and 2 brief updates now. And firstly, it's our Child Health and Wellbeing Network Inequality Advisors. We were very fortunate to be able to support a small number of people in trying to think more deeply about inequalities. And we wanted to hear from what they've been up to. And I think Luke's going to tell us a bit about that.
I am, Mike, and hello everybody. Great to be here. I just, before I start going, I just wanted to just pick up on something we were just talking about, that idea of the language we use and the idea of using underserved as opposed to hard to reach. And I think that's a really powerful shift, actually, because we know words are powerful. And I just wonder, there's 160 people in this room. If we all started, shifting away from this notion of hard to reach and towards, something much more inclusive, I guess, such as and less negative, I guess, in terms of underserved, and that'll make a real difference. So just a reflection there. But great to be here. My name's Luke Bramhall. I'm the head of Youth Services and Poverty Proofing at Children North East, as you can see on the screen in front of you. And colleagues also on the screen in front of you are within the list of participants here. We have been tasked as 4 individuals to really explore and understand inequalities, and particularly health inequalities, and how that impacts on the region, how it looks in relation to the network, and explore a little bit about what can be done. We are all inequalities advisors, but of course we all come from different places and have different experiences and specialisms, as you can see in front of you. I'll let you decide who the biggest poser is based on those pictures. But what I'm going to do is just talk a little bit about kind of what we're aiming for, and the direction of travel that we're taking as inequalities advisors to the network. And we've alluded to part of that already in today's session. So if we just click onto the next slide, and I'm going to start talking about, as I say, where we're going. We're not there yet, and hopefully today we'll get a little bit of help from you guys. So first and foremost, what we have kind of talked about really as inequalities advisors is something, if you like, a framework that would be really useful for network members. So across the region, we know inequalities are a massive issue. We've heard plenty about it today, and some amazing work that's going on to combat and alleviate and mitigate against those inequalities. But what we wanted was to explore how we could create a framework that allows work, because work is finite. We can't do everything that we would want to do. How can we target our provision to the areas that kind of have the greatest need, to the specific inequalities that are most prevalent and having the greatest impact? And so as we talked about this, and we connected with Heather and Mike and other colleagues with NHS England and learnt about this, what's called Core 20+5. Which was a really interesting model and great and fantastic, but as Mike alluded to earlier, a real focus on kind of adult services. And we were saying and banging and continue to bang the drum that actually we really need to look at this in relation to children and young people. We need to look at what the opportunities are to target and focus and pinpoint our provision specifically for children and young people. And so that's what we've started doing, and we think that nationally there's some noises on that, and that's fantastic. But in the North East, as Inequalities Advisors, we've started taking this framework and trying to apply it to the work that's going on here. Initially, so that as a whole network, we can look at a model that can pinpoint provision. But also so that as individual organisation and members and people, we can have a framework that can help us as we try and target and prioritise work that we deliver. So the Core 20+5, basically what we've been looking at is the 20% most deprived communities of the North East. We've been doing that through the IDACI framework, so that we can, so it's specifically related to the 20% most deprived communities or deprivation impacting children. And hopefully before too long, within a matter of months, we're going to have a resource that everybody can kind of access that will be able to understand which of those areas that are most impacted by that deprivation. Second of all is the plus in the Core 20+5, which is the what we might call disadvantaged groups, those that have poor outcomes. And these are directly linked to the protected characteristics that we all know plenty about. And one of the things that we are exploring is how we can connect with disadvantaged groups, specifically related to the inequalities that they face. So really important part of this framework. And the third part of the framework, if we click on one more slide, is having kind of core focused areas where inequalities are felt. So we've done a detailed review of the Facts for Life kind of resource that we carried out as a network. And we've highlighted 5 core areas where young people face real inequalities and real health challenges. And these are the 5 areas that we've highlighted in front of us: self-harm, family life, asthma, food insecurity, strong start in life. And you might be sat there saying, Luke, you said pinpointing, and I know that within each of these headings there is so much that we need to explore and unpick. But what it does is it gives us a starting point for really focusing in on some of the biggest challenges that we know children and young people are facing across our region. So we've got this framework, and it's kind of, well, these are 3 areas. What does that mean? How does it join up? What does it mean for us as a network, as individuals working across North East and North Cumbria? Well, essentially, we are going to be kind of presenting this framework, and initially and sharing this across network members. But what we want is that's fine. It's a framework, but how does it connect to communities? And this is so important. So we are going on a process over the course of the coming 3 or 4 months, where we are going to be focusing on one of these areas, and I'd be interested to get people's thoughts. We've got some questions on the next slide. We're going to highlight and think about some of the health inequalities that so focus on one of those health inequality areas. So let's say self-harm. We're going to pinpoint a specific geographic and disadvantaged group that are particularly affected by one of those inequality areas. But then, and this is where we're going to really rely on help from the whole network, because we need to identify, well, what's best practice? What's happening across the region already that's making a difference in this area? And secondly, what's already happening across nationally that we know of, that we've heard of, that that we can maybe need to bring to the North East and North Cumbria so we can target provision. And then the third stage, which is absolutely vital, is we then go into a community and we engage that community to work with that community to explore how they can be part of overcoming the particular inequalities that children and young people are facing. So again, if we stick with self-harm, how are children and young people part of that journey, that conversation? Really important. And then once we've done that engagement, we're going to kind of recommend interventions to target and reduce inequalities in that area. Now, this is the way that we as a network are going to start exploring and unpicking and targeting provision that's specifically responsive to the inequalities that we see. But this is the beginning, and we know that this framework has such opportunity for all of us, so that we can really ensure and have rationale for why we are directing our work in certain areas. So that's kind of a real brief. We've got some way to go, and we hope that there'll be plenty of opportunities, and we will be sharing our progress through the network. But we really want to connect with you as individuals in relation to the issues that are highlighted earlier, the 5 areas, in relation to that framework and thoughts and feelings around that. So to a certain extent, want to say kind of get involved, be part of it, monitor it, and let's see how we can kind of really create a robust model that's going to make a real difference. And we've heard today how much we need it. There we go, Mike. I think is that my slides done?
It is. That is indeed. Again, if anyone's got any comments or thoughts about that, and thank you for expanding on some of the work and thinking and how we can do this. Of course, the core 20+5, we're sort of developing some of the ideas early on here in the North. But I know there's a lot of, as Bola said, there's a lot of discussions going on centrally in NHS England about supporting this and how they may try and spread this as well. But I think it's good that we're already thinking in these targeted ways. And I think that debate about language is important, isn't it? Because it is. And I think there's a provocative comment there about, thank you, Liz Lingard, about some of our communities may actually feel somewhat easy to ignore. And actually kind of how we therefore work to ensure that we don't marginalise and we do have a true meaningful engagement and co-production is so important for us. So thank you for that. In the interest of time, I will probably move on, if that's okay. Thank you very much, Luke. On to Heather and Edward, who are going to talk to us today about just some updates on what we're doing and a little bit what might be coming next. Heather is our director of the network, and Professor Edward Cunningham is a public health specialist who does a lot of amazing work across all over the place, but across the south of the patch. So great to hear from you both.
Hi, thanks, Mike. And I'm not sure if Edward's joined us. Last time I looked, he hadn't yet. He's dashing from one meeting to the next, but hopefully he will join me at some point. So thanks. And it's really been my pleasure to have been part of the network's journey over the last 4 years, and in particular seeing this event come to fruition. And I was lucky enough to be part of the shortlisting panel along with David Gardner and Vishali Nanda. So thank you very much for enabling me to be part of it. So this section is quite short, but it's just to look at 2 different areas on the horizon. And you can see we've taken you back to the vision that Mike gave you at the beginning of the session. And at the bottom, which we always try to align to, is working in the priorities that you gave us and doing what you wanted us to do. So, and inequalities was threaded through all of the priorities that Mike showed you the wheel earlier. with poverty, mental health, vulnerability, equity to access. So they're all listed in there. But in particular, we were asked to share good practice. So thank you. If we just go on to the next slide there, we just wanted to share some key items. And I know the transition huddle has been put in the chat, but here's some things that are coming up. At the end of today, Jen's been working hard with the amazing, there's over 40 applications that we had. And you've heard from 4 or 5 amazing projects today, but there is so much else out there that we need to celebrate, and that's what the event's about today. So as Jen said earlier, there is a showcase brochure, I think that's the right title that we're calling it, which includes all the details and contact details of the different work that's going on in the North East and North Cumbria. And so that's a tool for you to receive some of the good practice that's going on and onward share it as well. The next item is we've got a children and young persons social prescribing event coming up in July, and we'll be cascading further links of how you can register for that. And that's in partnership with VON, and there's already a structured piece of work that's going on in the ICS in relation to children and young persons social prescribing. And we've been asked by the network to help facilitate that and host that event with them. So really keen that people are aware that that's on the horizon, and the particular role that it plays for those young people and families that are living within some of those underserved communities. And then the findings. So Luke's been sharing with you the core 20+5 focus for the North East and North Cumbria, and we heard Bola mentioning that there's lots of work not only in our region but other areas as well, but we're keen to share our findings with the rest of our region as well. And in particular the ICS development, and I don't know, I think this is something that Edward might want to come back to when and if he joins us, but he definitely sees this. It's a fabulous opportunity. Our ICS board comes into statutory organisation in July. There's a lot of changes at the moment and realignments, but that's a fabulous opportunity, but a challenge as well. We've got to stay connected across the child health and wellbeing system. So thank you. Can I go to our next slide? So the next area is just driving the work forward. And this is hopefully a pleasant announcement, and I feel bad that Edward's not here to be able to share that with you. But often to drive work forward, when you come together in partnership, and in the history of working in the network for the last 4 years, working in partnership is challenging. You have different priorities, you have different systems that we all work within, we have different budgets. And often just to get an idea up and running, it might just need a small amount of money to help get you to the next phase. And so what the network is hoping to launch next week, when it shares the showcase brochure with you, is also the details on how you might bid and access some small amount of funding. So on to the next slide. And what we're looking for is initiatives that are associated with children and young people's health inequalities, and associated to our priorities within the network, which are listed there, and they're on the next slide in a larger font so you can read them and mull over them later. And also the slide on the right hand side is the Children and Young Persons Transformation Programme, which is an NHS England programme that funds 10 work streams to progress transformation to children and young people. So we want the projects aligned to this, and we want items that are particular challenges that, oh, you know, this is the challenge, and if only we could unlock somebody to do this or someone to provide that, and we're not sure which budget or how we could come about that. We just want to help people to overcome some of these challenges. It could be a brand new project or an established project that it's just stuck at the moment and you're trying to progress it. So on the next slide is just those priorities, a bit larger so you can see them, but many of them very broad and will be relevant to a lot of the work that you're all involved with. And so really that closes our section, which Edward, I don't know if you're with us yet, but on to the next slide, Dan. And it's just to remind people to look out. So the application details will follow with the brochure from today's event. and also it will come through our regular network membership communications. So we've put in the chat a couple of times, and we really would request that people that have joined us today, and it's been fabulous. There's been different reports we've been messaging through the teams, and it's been over 181 at times. So it's been fabulous to have all these people connected. Do please register with the network so you'll see all our communications. You can register as an individual, but also as a group. We have a network of networks, which includes over 50 youth and voice groups as well. So let's make sure all the communities that we should be connected with are part of the network that we represent. So that's it from us, Mike, and apologies, Edward must have been caught in his previous meeting.
Thank you. Well, we're going to close and hopefully close on time, which is, for me chairing an event, that's maybe it's a first. But just a couple of things to highlight from chat. Thank you for people who've contributed into the chat. A nice little debate going on between Will Tasker and Helen. That our core 20+5, maybe it should be a core 30+5, because we've got quite a lot more people and young people in poverty and suffering inequalities perhaps than the averages in certainly England. So that's a nice little debate. Something from a Mrs. Bowman. Where is it again? Oh gosh, I've gone and lost it. I'll just mention something else while I'm screening for that. Oh yes, here we go. Just worth commenting on. Not sure if everyone's aware of the diff ability co-production. This comes into producing with perhaps groups of children who are easy to ignore. So children with various disabilities of one sort or another, that actually how co-production is really important to them, and there is information out there on how perhaps to go about doing that. So thank you for posting that. And then to end on that co-production line, and really for me just to reflect back how important that is. And there's been a bit of a thread throughout this. Thank you for those who've highlighted it in the chat. Thank you, Rachel and others. I think it is an important thread for us, the voice of children and young people. So I'm going to shut up now and wish you all well. But to close it, I'm just going to ask Julie, who's been, we're really grateful to have Julie's input into this. She's has a lot on her plate and lots of important roles to do and lots of things to do, but the health inequalities I know is one of Julie's biggest passions. So if you've got any closing remarks, Julie, we'd be grateful for them. Thank you.
Thank you, Mike, and you know, you do humble me, but thank you for that. But I think this has been a fantastic event, and I know that people need a little bit of time to go away and digest what's been happening today and the examples that we've been given of the fantastic work that's been undertaken. Thank you to Jenny as well for everything she's done to make this logistically possible, because I know that it's never easy to pull these things together. But there's some great themes come out of today, you know, from the vision at the beginning to the constant trends we've seen throughout this discussion around partnership and around, you know, engagement. Never have I seen such engagement of people in service delivery, in formulating our forward plan, and in thinking about what young people want and our children want and our families indeed want. You know, what has come across loud and clear are those relationships that are essential. It's not about building up governance structures, it's always about building up relationships. And whether that be across the projects we've seen or the strategic direction, it always adds strength, I think, to the movement around what we're going to deliver. So that co-production and the strength to the voices of the children and young people have come across louder and clearer in here than I've ever seen in any other project. But what has really, you know, dumbfounded me, I think, today is, you know, listening to individuals, listening to Claire, who posed a question of the reality of the situation she's facing, which brings us all back down to what it means in practice and what it means to individuals to have that personalised care and that well-being plan for the future. And that's where we need to maintain our grounding, I think, in terms of everything we do. Our value has come across loud and clear today across tackling health inequalities, specifically amongst children. And if we tackle some of those issues that we talked about early on in the agenda around child poverty, around sex education and readiness for school, and indeed around some of the issues we're facing around teenage pregnancy and substance misuse, I think we're really on a road to deliver something different for the North East and North Cumbria. So thank you to everybody for their participation. I'll add that to Mike's thank you. And thank you to Bola for giving us, again, that inspirational approach. But what is, again, let's just leave today thinking about the aspiration we have and never ever let that go. And we look forward to the digital showcase brochure that Heather's forewarned us about and the funding opportunity that Heather's posed to us as a challenge. Thank you again to everybody.
And thank you, Julie. And for the final things from me, I guess thank you particularly to people who've done the work, to all the 40 projects that were put forward. It was horrible to try and find 4 or 5 that we could present, but I hope in doing so that you have all heard something that has sparked some curiosity or something that you'll go away with and think about. Thank you for your attendance here. Particularly thank you for our young advisors who helped help select some of these projects and provide some comments and great feedback for us, which was very important for us. Thank you for the network team, particularly who pull things together and do the organising in the background, and obviously spearheaded by Jen. Jen, awesome. Thank you. We really appreciate it. Thank you. And for everybody, yeah, keep going, keep doing it, and we're treading in a new direction, and keep taking one step after another. And we'll see you all again.